Accreditation survey process before the surveyors arrive. I could have almost started with the accreditation survey process after the surveyors leave, because what we're going to go over has to do with what we really do between surveys, or what one would call continuous readiness. Before the surveyors arrive, we have quite a few responsibilities. In fact, we have so many that really it's impossible to do all the things that we need to do for survey a month, 3 months, 6 months, even really a year before the surveyors arrive. We need to be doing many of the things we're about to go over on a continuous basis. And if we're not, we're going to find ourselves falling short in areas and really going through sort of a chaotic survey process. We're going to start off about documentation. In fact, I'd make yourself a cup of coffee if you haven't already and come back to the presentation here, because we're going to talk a lot more about documentation on this presentation. Really, documentation is the key, and a lot goes into creating documentation. It is it's probably one of the reasons why I focus so much with you all on when you all write reports or when you all do your discussion boards on your documentation and your formats, because documentation is so key and vital to the success of the survey process. And we really need to be excited about it at times and engaged and really come to enjoy documentation. I think that if you really, truly hate documentation, you really should consider not being in the healthcare facilities leadership world, because it is such a critical part of what we do if you're going to do it well. First documentation you want to talk about is management plans. Management plans are not required by every accreditation organization. The Joint Commission does require them, and others do as well. I believe they're an excellent document that we should have. These plans are a high-level overview of your department. What do you do, and pretty much why do you do it? They should be reviewed annually. They really need to be submitted to an organizational committee over safety, or maybe risk management or performance improvement. This allows you to ensure that you're integrated in the organization. It also allows you to look at your scope on a continuous basis. Scope can change. Sometimes your bed size can go up, sometimes your bed size can go down. Sometimes you add services, sometimes you decrease services. Sometimes you add new and unique equipment, and sometimes you lose equipment. Sometimes your community will add industries, or maybe crime will change in your community. Maybe you have an increase in gang activity. And in some cases, maybe you have a decrease. But for all those reasons, you need to be looking at your scope of work and scope of responsibilities and adjusting that in your management plan. This is also the place where you put you start talking about performance measures. How do you measure what you do, and how do you know you're doing a good job? Performance measures, there are standard measures out there across our industry, but this is an opportunity to also identify performance measures that are unique to your facility or to your staff, or things that you're engaged in trying to work on or measure. I think this is a wonderful opportunity for new students coming into the industry to move, if you will, our profession forward. You also want to reference codes and standards and regulations. This is a high-level mention. You would mention the whole code or standard. You'd mention, NFPA 1999. You would mention, Life Safety Code 101, 2000 version. You'd mention those high-level versions of codes and regs that you use and follow, but not the detail in your management plan. But a very important document. It's sort of a guide document to how you operate your department. The next big document that we're going to talk about is Statement of Condition. The Statement of Condition is really an overview for life safety features for your buildings. Whenever you have a building where people cannot self-preserve, it's going to be a very detailed information. It's going to talk about many features of your building. Its construction type. Talk about your doors, your corridors, your compartments, your latches. It'll get into great detail about sprinkler systems, things like that, fire alarm system, length of egress, things like that, compartment sizes. So this is a very detailed document when it comes to a place where patients cannot self-preserve, typically hospitals or ambulatory surgical centers. Now, when you get into more basic buildings like doctor offices or purely outpatient centers, it becomes much more basic. They're really looking for square footages and construction type primarily. This document must be reviewed annually. Most everyone now, I believe, does review this electronically. There may be a few people who still do it by paper. And this is also where you'll want to keep your waivers. If you have any waivers specific to your building construction type or life safety measures, you'll want to keep waivers that you've received from authorities that have jurisdiction or CMS. And you'll want to make sure that this is where you can point to the surveyors to why your building may have an exception. But going from the statement of condition is often where we get our PFIs, plan for improvements. We've identified an issue with our building. For example, let's use fire dampers, which is a common one. Very often, there are fire dampers in our walls and our ceilings that are inaccessible. And we know that we cannot get to them for various reasons. So we say in our plan for improvement that we will, in the next 3 years or 6 years, spend X dollars, or we'll do a project. And when we do that project, we will get to those dampers and we will address those dampers. And that would be a plan for improvement. Now, they do allow extensions. I believe you're allowed up to 12 years total to extend a plan for improvement. And some people do take that full amount of time to do that. It's not unusual to address issues not directly tied to life safety code as your PFIs as well. I think there has been sort of an understanding or acceptable understanding that if you put other items that may not be directly life safety code specific, for example, medical gas issues, into your PFIs, they'll be accepted. I'm going to jump down to the get out of jail free card. PFIs allow you, your plan permits allow you to let your surveyor know issues with your building, and the surveyors will then overlook those issues as they survey you. I think that's the reason why you'll see other things slip into plan for improvements that are not specific to life safety code, because there is a perception, and it's been validated, that the surveyor sees you have a plan for improvement. They pretty much kind of go, okay, well, we're not going to, quote, cite you on that. We see you're working on it. You want to make sure that you monitor and update remediation dates. You got to stay on top of that. Make sure that if you've corrected something, you notate that in your statement of condition and that you tracked it with good documentation. And then you want to make sure this is all organized in a nice binder with the new, the old, and the completed for historical documentation and for next survey and for all surveys. Policies and procedures. This is one of those areas where I think that many of us can always get better at it. I think that there's also an opportunity for the networking within our profession to get stronger. You'll see a lot of questions on the listserv about policies and procedures, people seeking policies and procedures. You'll want to make sure your policies and procedures are updated, that they have a good date, timestamp, that they've been reviewed recently. You'll want to make sure your staff have awareness about your policies and procedures. And really, you want to do what you say and say what you do. The key here is to make sure that you do not go below minimum regulatory standards and requirements, but you keep it simple. Be careful borrowing policies and procedures from others that look really good and sound really good, but don't necessarily fit what you do. It's better to just keep it simple. Again, do what you say what you do. Make sure they're organized and accessible, and that they do not contradict other policies and procedures within the organization or within your system. And that's where the integration comes in. It's a good idea that to compare and share policies and procedures with other hospitals. Sometimes this can cause some problems because some people hold on to their policies and procedures and don't like to see them changed. And it's hard to sometimes adapt others' best practices when we think our practice is the best practice. But it's important to integrate these to make sure that you support each other if you have several hospitals in the same system. Risk assessments. Risk assessments really are not used probably as frequently as they should be used, but they are being used more frequently because we're finding that they are ways to help us do more meaningful work. They protect us from legal issues. They increase productivity. And surveyors really like them. They like it when we put on our critical thinking hats and we evaluate what we're doing and we assess it for risk. There's no doubt that if you have a piece of equipment sitting in an office in accounting versus having a piece of equipment sitting in a critical care room, those are two completely different environments. And that piece of equipment that sits in that office, we may never look at it. We may never check it. but that critical care piece, we may check that 4 times a year or maybe monthly. And that's the kind of risk, that's the basic ideal of risk assessments, that you've evaluated your systems, you've created a risk assessment that's based on some good thinking or really good data, and then you're able to say, okay, here's why I do what I do, or don't do what I do. And hopefully that leads to, again, better productivity, more meaningful work, and certainly protection. That you want, again, make sure they're justifiable, and really make sure your staff knows about your risk assessments and why. The same thing, make sure they understand why they do some things in some areas and don't do other things in other areas. This is a really important part of staff training. Maintenance records. If you have a good computerized maintenance management system and you have a good computer user and your technicians are good putting data in, and you have a good way of pulling reports, and you're optimizing your maintenance management system, records become a much easier process. Unfortunately, a lot of folks have these computerized maintenance management systems but really don't utilize them to their potential. As a result, they often have lots of paper records as well. Now, I'm not going to knock paper records down all the way, because paper records have a place, and they can be very, very helpful for us to use, especially for checklists and such. Certainly we need them for surveyor preparation and for review, but at the same time, I do believe that a lot of folks still manage way too many paper records. The information, whether paper records or computerized maintenance management system, need to be detailed information from the staff. You want to make sure that you notate your in-house work order number with any vendor work order number or work order, so you're tracking issues. Lots of times a vendor will come in, they'll do a service, and something will be found during that service, and we got to make sure that we identify that issue and that we track it through, because again, that equipment is our equipment. We have ownership of it. We're also responsible for contractor activities and records. Just because they say they PM something or because they say they've addressed an issue, it doesn't necessarily always mean they understand the codes and standards we're held to. So you have to make sure that they are doing things by codes and standards. A classic one that I remember back in the day was we had our fire system being inspected, and during the inspection, really we didn't find out till later that they were not checking our shutdown devices on our air handlers during the inspection. And the reason why was because the shutdown devices were actually not tied into our fire system. They were separate island or siloed shutdown devices. And this particular vendor said that, well, we only test items that are part and tied into the fire system. We don't test these separate components. Well, that got caught by a surveyor, and of course, we remediated it. We took care of it. We had to rewrite the contract to include it. But that was required. It's right there. It's required, and we just assumed, hey, they know that we have to do this, and they weren't doing it. And so it took a surveyor to point out that we needed to get that covered. So there's an example of where here's a vendor you assume knows their job. They're a fire panel testing company or a fire equipment testing company, and yet you have a big miss like that. Again, always make sure you have your project documentation as well and keep those records in nice order. I know lots of places do small projects in maintenance, whereas large projects go off to maybe a construction management team within your organization or otherwise. You still got to make sure you have that project documentation in your records. Drawings. Drawings is a big subject because a lot of folks are managing so many different ways today, whether it's an electronic CAD measure way you're doing it or paper documents. I think most of us still deal an awful lot with paper documents. There is a day, I'm sure, coming where we will deal with few paper documents when it comes to drawings, but I think we're stuck with paper documents for a very long time. And one of the complications with paper documents is there's so many revisions of documents during projects that to actually put your hands on the as-built and have those organized in such a way for your staff to use, I think is an ongoing challenge for many facilities around our country. Just tracking building changes over 50, 60, 70, 80 years is a challenge. But you want to make sure you have those drawings because the surveyor may want to look at those drawings. You want to make sure you have life safety drawings, which show compartmentalization and fire features of your organization, and your utility drawings, which are required, and your floor plan, just a basic floor plan for the surveyor, because they're going to want to see that floor plan to navigate your organization. Quality documentation. I put down here greater than 1 year's worth of data. If it's less than 1 year's worth of data, it really doesn't have any real trending, so it's hard to use. In fact, it typically won't be accepted as quality data. It's important to understand that if you write a summary each month and you look at your data on a regular basis, write a little paragraph, did it change? Was there a trend? Was there a variance? Then you can track that month to month to month, and those variances will often add up, and then you can start following up on these things and make it more meaningful. If you do that, that's a nice cycle, and then as you find issues, you can create staff awareness. Your staff will be aware, then you can correct these issues or adjust these issues, and then take credit for it. And you can use those for later on for the next subject, performance improvement. Performance improvement should be an ongoing, and it really comes from quality. When you're measuring your quality, or if you're measuring meaningful work, you're always going to find opportunities to make things better. And again, this is where the ideals aren't necessarily always your idea. These ideas can often be staff ideas. And as you're looking at data and work orders and quality, and these things come together, or you have incidents, or maybe you're doing risk assessments, you can pull together, something to work on. Again, a performance improvement project. Now, keep in mind, performance improvement, it cannot be used to meet a regulatory minimum. So let's say, for example, you're meant to do risk 1 PMs on equipment at 100%. And you have found during your quality for several months, you've been trending at 96%. And so you say, we're going to do a performance improvement initiative, and we're going to bring our quality up to 100%. Now, internally, that is a performance improvement activity. But from a regulatory perspective, that's a violation. So really, you cannot use those for, improving. Now, let's say, for example, you have a regulatory item of doing PMs on risk 1 equipment, and you're doing it at 100%, but you see a trend that there's a problem that keeps showing up on the PM repeatedly, a repair or something like that, or some issue. Now that can be turned into performance improvement activity, where you improve the process or you improve the PM issue. Make sure you track and record your history, that you write a regular summary again, and that you follow up. And again, make sure your staff's aware of all this work, and that you tell the story, and your staff can tell the story. When you make changes to improve things, your staff should be able to articulate that story, and you want to be able to tell those stories as well. In fact, the more stories you collect, it just makes it, again, it really, really helps the surveyors and helps your survey process when you can tell stories and your staff can tell stories. Other hospital activities before surveyors show up. The thing about before the surveyors show up, everyone sort of, especially 6 months, 3 months in before they show up, people start to get very, very different about their areas. And this is one of the reasons why you really need to be going continuously, being prepared for survey, because the closer you get to that day, your time will no longer be your time. Your time will be spent helping others. And here's a list of things that you'll be addressing. Aesthetics become just kind of a constant drumbeat, from painting to ceiling tiles to flooring to chairs to, you just don't know what it's going to be. There's so many aesthetic issues that start cropping up, and you end up having to prioritize what you need to do, what you can do. Clutter becomes another big issue. Be surprised how many things that people need you to store long-term or short-term, or they're just getting rid of, which leads to storage issues. You'll want to make sure long before you get into the accreditation cycle, especially the last 6 months, that you have your storage areas all cleared out, because inevitably they're going to get filled up. And you want to make sure you have a good process of getting rid of things. One of the ways to address this is to participate and be engaged in environmental rounds and administrative rounds. Environmental rounds should be going on all the time between surveys. Administrative rounds typically start to happen leading up to survey. But be involved in both. It's a great way to make your job easier on the long run. Also, before survey, you want to make sure that you're taking a good hard look at your projects and your contractors and your vendors. Because your projects, your contractors, and your vendors are going to be very important when survey happens. You want to make sure that they know survey is coming. Very often, project management folks particularly, they don't want to be around when surveyors are around. You'd be surprised how much they can, how they disappear when they know the surveyors walk in. And you may have certain contractors and vendors, you don't want around as well. Let's say, for example, you have vendors in the hospital that are pulling cables. Well, you want to be sure to let those folks know that if there's an announcement that the surveyors have arrived, that they're going to be put on project hold. In fact, it's probably a good idea to try to get as much of that out of the way before surveyors arrive anyway, because you never know what kind of problems they can create during the survey process. Same thing with vendors as well. Now, your documentation and the presentation of your documentation, we've spent a lot of time looking at all of this documentation. You really want to make sure that you've compiled it and you've placed it in binders and it's organized, has easy flow. You also want to make sure that your staff is aware where it is, because there's a possibility, you never know what's going to go on. It could be a wedding, a birth, a vacation. Although many times the hospital will tell critical people in critical roles they have to cancel their vacations as much as 3 months out before survey could occur. So you want to make sure that, but the things still happen. You may be on vacation. Again, if you have a great running department and you have trained your people well, in theory you don't have to be there. Although really, as leaders, we should be there if at all possible. The other thing is a checklist. And I'll talk about this again later, but know thyself. Each department have certain issues that they have to address that are specific to their environment. We had a survey readiness checklist, and that checklist was on a clipboard. There were multiple pages. And then when the surveyors showed up, the staff would just take a sheet, and they were pre-assigned, and they would go check things just to validate, to make sure that there were no issues in certain areas, certain common problem areas in our organization. This is a valuable tool, and I would encourage everyone to have a survey readiness checklist for survey that they kind of crack open the day the surveyor walks in. Because again, if you take your staff and you spread out, you can just get rid of a lot of minor little gigs by doing that, especially if you know your environment well. But that's an excellent tool that I would recommend. Accreditation organization trends. Again, before survey, you'll be wanting to read a CMS report. We're going to be going over that in our course. They'll tell you about what the survey organizations are focusing on. You'll want to talk to other hospitals, because the other hospitals will have some insight as to what the accreditation organizations are focusing on. And then organizations' literatures and presentations. George Mills was always famous for going to his presentations. He'd tell you straight up what they're looking at this year. And so you can focus on that. The surveyor themselves, I'll tell you what, there used to be a lot more pet peeves and trending with the surveyors by personality. It's not quite that way anymore. I think they're better trained. I think that they're following marching orders from the organizations better. I think they're more focused, which really they don't vary quite as much as they used to. But they still do have some pet peeves. Again, they're people like anybody else, especially if there's something going on nationally. If there's flooding or abductions, OR fires or shootings, or something major has happened in our country. They come in with sort of a mindset, thinking about, well, hey, have you been thinking about this? What did you do when you heard about this on the news? Have you done anything at all? Have you discussed it? And so that can be, something that could affect you, and the surveyor may bring to the table that you just weren't preparing for necessarily. Again, I told you continuous preparedness on the front end. On the back end, that's really what it's about. None of this can really be done in a short amount of time. It has to be something that's planned out over a long period of time. And if you don't do it over a long period of time, then when you come to survey time, you're going to be feeling vulnerable, and you're going to be wondering what you didn't do. But if you've done this in between survey cycles and you do this on a continuous basis, again, you have a nice tightly weaved basket, and I believe that for the most part, you'll be able to get through survey very, very, very successfully. Again, this is the biggest portion. Next thing we're going to do is we're going to talk about when the surveyors arrive.